Mosby's Guide for Catheter Insertion and Care. Please pay close attention to the...
Actually, this is the real story. Just come follow me.
The following clip, the names have been changed to protect the innocence of the individuals.
Okay, so 2202 and 2203, I mean, they're fine. They're just chilling in there, just kicking it. We got Meddy Biller and Linda Glosson. She's just, I mean, they're fine. But 2204, Mr. Euron, I mean, you have got to get something done for him. You have got to get him a Foley. I mean, he's just annoying the mess out of me. He, up all night, I mean, just asking me to do all this stuff for him, I can't handle it. So, I mean, you've got to get him a catheter. Catheterization! Hey, Mr. Euron, I just wanted to let you know we're going to go ahead and get that Foley in for you today, and it's just, you know, I'm just sorry, but I can't keep changing your sheets. But I don't want a catheter! I know you said that you walk and that you're fine, but, I mean, the doctor wrote it, and I can't, I'm sorry. We're just going to have to put this in for you today. Mr. Euron in 2204, he needs to get a catheter, but I think it's going to be really hard. Who are we going to call? I mean, I don't know what we're going to do.
Well, we need a professional.
We do. Who are we going to call? Rahende!
Also known as Rebecca Henderson.
You just rest at ease, Mr. Euron, because we have called in the professionals to put in your catheter.
Get crazy with this thing. Don't you know I'm loco?
Woo! Yeah! Oh. Alright, what do we have here today? Alright, Mr. Euron, I'm here today to put your catheter in, and I'm going to show these students how to properly enter a catheter. Alright. Well, Mrs. Euron there! Surprises everywhere today, everyone! Alright, well, I have some lovely students that are going to be educating today on how to properly insert a catheter. Rule number 1. Always sterile. Sterile, sterile, sterile. Your biggest problem in inserting a catheter. Now, some hospitals have trouble with UTIs. We do not. Alright, first of all, well, I love these jokes. We're going to set up our field. Okay. Okay. Properly take out the cloth, and you're going to lay it peacefully over the abdominal area. Now, before you set up the field, you normally wash your hands, but my hands are always clean. I use that new antibacterial, and so it cleans it, so I don't need it. And normally I don't use gloves, but I might use gloves today, because just a little precautionary. Okay, so remember, always sterile, okay? Sometimes these guys kind of stick together, so you gotta rub them together, get them apart, okay? All right. Once you get your gloves on, you're gonna ask the patient, Mrs. Euron, to assume the position, which involves bending of the knees at the patellar area. Assume the position. All right, next, you're going to take your other cloth, keeping everything, oh well, bigger hole. All right, you're going to just drape it over the wanted area, like so. All right, then you are going to set up everything. Oops. Just gonna wipe that off real quick. Set up your bag. And you always want to keep everything sterile, mind you. Okay? Everything sterile. Sometimes it'll get away from you. Got it. Alright. So, then you're going to clean the area around the meatus. So you're going to squirt just a little bit. Just, oh, well, shoot. All right, just kind of squirt some in there. Okay, so after the cotton balls are saturated, you're going to pick one up, keeping it sterile, and then you're going to place your hand and clean downward, upwards. And it's a lot of times better if you start from the outward, inward, because you make sure and get a proper sterile feel from that. So we're going to go down and up. And then after each cotton ball, you're going to get a new one. Dip it. Oops. Outwards to inwards. Get away from you, little sucker. Okay. So you have cleaned the site in preparation for insertion. Okay, now let me remind you, during this procedure, it is proper to wear safety goggles and a hairnet, because you don't want any of their funky stuff getting on you. So I've prepped the site for insertion. So now I'm going to get the catheter ready. Let me just grab. All right. So, while maintaining sterility, we're going to lube up the tip of the catheter. Now, most hospital settings will use like KY jelly or something like that, but I don't really like KY. So, I've come with a personal favorite of the body's natural producing secretions, spit. So, what you do? Take it. Now you want to rotate it as you pull it through the saliva, because that gets good lubrication on it. So there you go. So now we're all lubed up. Kind of gets tangly. Okay. Assume the position. Now you're going to tell Mr. Urine that you're going to feel a slight sensation down there, but you know, it'll be over quickly. So we're going to go for the hole. Oh, no, wrong hole. Slight sensation. Oh, wrong hole. Third time's the charm. What do you know? All right. Okay. Once the catheter is in, you want to make sure it's not pulling on the patient. You know, sometimes it comes out, but that's okay. You got to be prepared for these situations. You just quickly reinsert it. Okay. Now you're going to take your solution and you're going to apply it to the syringe, and then you're going to push all 10 cc's in there. The bigger the balloon, the better. Okay. After we got that finished, observe for some urine output. Looky there. All right, that's beautiful. And then you're going to take it and you're going to hang it next to IV pole so the patient can see the output that they are producing. So it gives them a reassurance that everything is working okay down there. After you're finished, you're going to wrap it a couple times around the leg. Now that the catheter is securely wrapped around the patient's leg, you can be sure that it's not going to come loose. Now, once you have it secured, you want to look down in there. Oh wait, get a better look this way. Yeah, that it's secure and that it's patent. So once you get finished with that, you don't ever want to forget to label. Labeling is extremely important. So, you know what? We're done with these. We don't need them. So you're gonna take the label and you stick it on the inside of the leg where the tube is. So it helps extra secure the tube. So after you're finished, I mean, like, I am a professional, so I don't clean up my mess. So you call a nursing student in to look at it. And the easy access of the bag can be seen from the nurse's desk outside, so you don't have to come into the room to look at it. So that is how you put a Foley in. It's very easy, and I mean, perfection, what can I say?